Have you had your exercise today? No? Well, if you need some motivation, this next guest is just the man. I'm Bogda Kozwara, and this is Supportive Care Matters. My guest today is Dr. David Mizrahi. David is a research fellow at the Daffodil Centre at the University of Sydney, researching exercise during and after cancer treatment in adults and children. He is the chair of the Exercise and Cancer Committee for Clinical Oncology Society of Australia, and he recently was awarded as Accredited Exercise Physiologist of the Year. Welcome to the podcast, David.
Thank you so much, Bogda, for having me along. It's a pleasure to be here.
So we're going to talk exercise or maybe physical activity or both. So I think we should really start with some definitions. What's exercise? What's physical activity?
Yeah, it's a really important delineation of the term. So exercise is more structured, repeated bouts of physical activity, particularly in a clinical setting. It can be more of a prescription where we have specific targets based on dose or intensity of the physical movements. Whereas physical activity can refer to any type of bodily movement that can be tiring to the muscles. So that can be things like gardening or walking, or more leisure type activities as well, like bushwalking and hiking. They're all fantastic. Any movement is great. But in terms of clinical exercise interventions that are done with clinical populations, such as people with cancer or heart disease or other populations, a lot of the research has done exercise trials where they might give a particular dose of cardio or aerobic exercise, for example, at a targeted heart rate, or resistance exercise at a targeted muscle strength ability as well. So there's the two differences. In general, the term physical activity is more inclusive, and it can be less intimidating term to use as well for people, particularly when they're starting off.
So they both are good for you, and perhaps exercise is a little bit easier to prescribe because it's more specific. But why are they good for you? What are the benefits, in particular for people with a history of cancer diagnosis?
But there's so many benefits from exercise, and we know that exercise and physical activity, there's many physical and emotional benefits in general for the general population. We know we feel better when we do it. So there's neurobiological pathways that you get some benefits in your mood from very shortly after doing exercise. We know that our heart can become strengthened when we do cardio type exercise. Exercise has been given to people with heart disease for decades now. We know that people can improve their strength. So when you do resistance exercise, it causes tiny micro damage to the muscles that actually heals and becomes stronger. So we get stronger muscles, and that's great, particularly for older patients or people with balance problems or people who have deconditioning, for example, through cancer treatment. They can get stronger muscles so they can preserve and maintain their functional capacity to keep doing the tasks that they want to do, whether it be their ability to work or pick up their grandkids, or just be able to, even get back to the activities like golf or anything that they want to be able to do. Also, there's other benefits as well, like metabolic health. We know that people with diabetes, again, have been prescribed exercise for a long time, and there's many benefits there. It can improve lung function as well, which is particularly important. And I can really go on as well for the different types of benefits, but all those different benefits that you get from exercise then can improve your clinical outcomes. So people are more likely to live longer and less likely to actually develop chronic diseases as a result of having that healthy lifestyle. So you can start to see that there's many benefits there. And there's this famous quote, I suppose, that if all the benefits from exercise could be wrapped up into a little pill, every single doctor would be prescribing it. Unfortunately, it just takes a little bit of hard work compared to taking a pill.
Yes, it's a little bit harder than putting it in a water supply, isn't it?
That's right. That could be a good way to do it.
Now, you've listed exercise benefits on individuals, both in terms of physical strength, greater well-being, potentially even improved survival, less chronic diseases. You've also published on the benefits of exercise in terms of how it benefits the health system because it might reduce hospital stay. Tell us about these research findings.
Yeah, this is something that we've been looking into a bit more recently. So we've been seeing for decades now that patients will benefit physically and emotionally from doing exercise. We know that already. So now we're looking more deeper. How can patients who are more active, how can that help improve the health system? So I published a meta-analysis recently in the British Journal of Sports Medicine that synthesized all the studies that looked at hospital stays for patients who were doing exercise during their primary cancer treatment. And what those studies found was that when patients were doing exercise programs during their chemo or their radiation or their stem cell transplant, they were less likely to be admitted to hospital. They had shorter hospital stays as well. So what that's telling us is that exercise actually has benefits in terms of reducing hospital stay. That can save thousands and thousands of dollars per patient per stay, and particularly over the thousands of patients that are diagnosed each year. That can be enormous savings for a very cheap intervention that exercise can be. Now, there's numerous potential mechanisms for these benefits. For example, there can be unexpected hospital admissions for patients who have falls and become very fragile and have a lot of deconditioning. So patients who improve their strength and the functional capacity are less likely to have a fall. This can also occur for patients who develop peripheral neuropathy, which is really common from some neurotoxic chemotherapy agents. So if patients can preserve their balance when they can't feel their feet very well because of their neuropathy, that can as well potentially lead to them preventing them from having a fall and an unexpected admission. Also, patients who are more active can be able to tolerate their treatment better because they're fitter, they're stronger, they're less likely to have adverse events resulting from their treatment. And that's something that's been quite established in the previous literature, that patients who are fitter, where they test them with exercise tests, are getting less adverse events. So, if we can get patients active, or at least promote the use and endorsement of exercise right from the beginning of treatment, we can fight these side effects that we know are so common from treatment. We can fight them early on and hopefully prevent the need for patients to have unexpected stays in hospital, which can be quite worrying to patients and their families, particularly if they're, if it was not expected, not in their plan.
And of course, it's a strain on the healthcare dollar as well.
Yeah, certainly. I mean, the cost depends on each center, but it can be thousands of dollars each day from being admitted to hospital. So if a patient has an unexpected stay for 4 or 5 days, that's really a lot of money that adds up so quickly. So we want to keep patients out of hospital if they don't need to be there. And that money, again, can be better spent on other things. So, exercise physiologists and physiotherapists or allied health professionals, they're not expensive to hire in that context. If we can save all that money and rather invest that into those health professionals to service the patients that can get benefit from doing exercise, that would be fantastic. Because currently most hospitals in Australia don't have access to those programs. So it's really quite a gap in the system right now.
That's right. So health economic argument might actually win that and perhaps change how we deliver care.
That's right. I guess we'll have to watch this space, but we do have investigations underway in that topic. We've got COSA, the first exercise and cancer fellowship, which is currently underway, which is Dr. Kim Edmonds, is looking at the health economic evaluation of exercise and cancer trials to answer that question. So we'll have more information later in the year, presented hopefully at the COSA ASM.
Fantastic. We'll watch this space with a lot of interest. So now that we know that exercise is great for you, how do we start? What type of exercise? How long for? And is the prescription for exercise for people with history of cancer the same as for somebody who doesn't have a cancer diagnosis?
Oh, the $1 million questions. You go asking all the hard questions here, Doctor. So, where do we start? It really depends on the center. I think it's super important if the clinician in charge of the patient is sending the message that exercise is both safe and beneficial, because patients will listen to their doctors. If they're not pushing that message or not portraying that at the important moments at diagnosis and other times in their consults, patients might not take it as seriously, and it will put it into the box that it's something that would be nice but not essential. If we can get all patients active, we know that they'll cope with treatment better. So it is something that needs to be discussed from the beginning. So that's one thing that's quite important. Other things are discussing, or I guess making those partnerships with community health services. If you don't have in-house exercise professionals, so you have the ability to refer patients to a exercise professional that you know and trust, and particularly one that you can potentially communicate with. Because if your patient's undergoing treatment, and you're referring them out to the community setting, they may have questions to ensure the safety of your patient. So having that two-way communication channel between tertiary hospital and community exercise professionals is best, I suppose, for patient care. Now, in terms of what exercise to do, it's extremely individualized. Anything is better than nothing. The health recommendations or the guidelines do recommend up to around 150 minutes of moderate to vigorous cardio type exercise. So walking, jogging, or hills, swimming, cycling. So 30 minutes on most days of the week, but also 2 sessions of resistance type exercise. So that can be doing weights or resistance bands, or even using your body weight, for example, doing squats out of a chair or push-ups against a wall. But to be honest, if someone likes doing something, like if someone only likes yoga and doesn't want to do anything else, even though it's not optimum, they're not doing everything, I don't mind, because they're compliant. If they really love something and they're doing it lots, then that's fantastic. We don't want to fall into the trap of people just sticking with low intensity exercise. Like if they're only going for walks, for example, I think it's important to reiterate that it's great and it's better than nothing, but we do need to get challenging type exercise in to really get the benefits, because exercise is a dose response beneficial intervention that the more you do and the harder you do it, the more benefits that you start to get. But yeah, I think for some people who haven't done exercise before, that's where it can be a good challenge to teach people what's beneficial for them, particularly if they haven't done, for example, resistance exercise before. So we'll be starting really, really easy in their programs just to get them comfortable and, not an intimidating environment, and then slowly building up. And usually after about a month, people they love it. They start to get really into it, something never done before, and they can feel the benefits. So that's really rewarding once you get to that stage. But yeah, starting it off is certainly the hard part.
I'm reflecting on the fact that our thinking about exercise have changed quite dramatically over the past few years. I remember the patients who I treated who would come into my clinic and say, my doctor told me that during chemotherapy, I should do nothing and rest, and I can really pick things up after I finish my chemotherapy, which is in my line of work quite problematic, because some of the chemotherapy that I give takes a year. And sitting on the couch for a year is probably not good for your health. You were quite innovative in putting exercise equipment into the chemotherapy room. How did that work out for you?
Yeah, honestly, it comes down to the support of the organization. And where I was at, we did exercise for women with relapsed ovarian cancer, and it's quite a deconditioned group, poor prognosis, but they loved doing the exercise. It was a culture shift. Like you said, there was a time where people were told just to rest, do nothing, but only after a couple of weeks, you really start to decondition. You lose muscle mass, you lose cardiovascular fitness, and that can, increase your risk for cardiovascular disease. So it's a shift. It's a strange shift, but all the nurses are on board that exercise can be beneficial. We've got bikes now in a study that's happening in Chris O'Brien Lifehouse, patients who are actually having chemotherapy infusion at the same time. And, they come in for hours at a time sometimes. Patients even bored sometimes. They want to do something. They're just pedaling away we have this mini bikes we bring in, and they love it. We don't do very high intensity. It's probably low to moderate intensity. They're not really getting sweaty or anything, but they feel good when doing it. So we're monitoring their heart rate. We do questionnaires as well, looking at their fatigue during and after, and also acceptability of an intervention like this. And I remember hearing about this from Lee Jones, a researcher from New York, and I think lots of their clinics in the States, they all have bikes accessible to them. And that's what we're going to do in one of my projects soon. I'm going to be doing a study for children who are recently diagnosed with cancer. And they're often inpatients a lot, and particularly if they're having a transplant, they might maybe there for weeks and weeks and weeks. And it's boring, like we want to be able to get them to do something that can be fun, games-based, play-based. Nintendo Wii's, moving around, throwing a ball to each other, stationary bike for the older kids. Yeah, it's about a culture shift, I think is important. We already have it in cardiac rehab. It's been the norm. If you have a heart attack or a stroke, you get exercise. That's how it's been for decades now. So we need to copy their model and make it even better and ensure the health of our patients.
But you correctly point out that this is not just providing the evidence, it's also shifting the culture within the environment within which we work. And I guess if we were to convince the patients that exercise is good for them, then we really need to demonstrate that ourselves. It's no good talking to the patient about exercise when you don't exercise and you sit in your consulting room eating something that's terribly unhealthy or not eating at all for that matter. So I think that we also need to influence the healthcare providers. How do you think we can do that?
Oh, that's a hard one, isn't it, Bogdan? I know you're a keen runner and I'm a keen runner, but not everyone likes running. I know there's some keen medical professionals in the cancer space that do love exercise, but it's not for everyone. I just remember seeing a meme, I think, with a doctor smoking back in the olden days. But yeah, obviously setting good examples is important. I know again at Lifehouse there's a gym there for patients to use. And sometimes one of the doctors comes down and goes for a run and the patients are so inspired by that. It really motivates them. It's a really nice thing. I think that's going above and beyond. So it's obviously super inclusive. There's also, I don't know where it was, but I think it's a GP initiative. It's programs called Walking with Your Doctor or something like that. The doctor goes to a park and then the patients can go with them. It's some public health initiative. It's actually a really nice, neat idea.
It's better than walking with your dog. You could just walk with your doctor.
You could bring your dog and visit your doctor. But I suppose leaning towards those type of things it's a nice thing. There's so many nice green spaces around plenty of some hospitals. And, if we can be innovative and do programs like that, that's a really nice way to offer a nice physical intervention. But there's also social benefits as well from doing something like that.
Yes, absolutely. And in Australia, the climate is so accommodating that, there's plenty of days when you can go for a walk or run or whatever without really worrying that you're going to be snowed under. So I think we should take advantage of it.
Yeah, we are lucky. We have fantastic weather here. My sister was living in the US a couple of years ago and it snowed for 2-3 months or something, and it was minus 20 degrees. We don't really have to worry about that. It's relatively safe country in most areas, so it's quite lucky because some places around the world don't have that as much. So we do have lots of green spaces and we don't have to worry as much. So we are blessed, and there's some beautiful beaches and some great places to do exercise. I mean, in Sydney, if you go anywhere along the coastline in the mornings, you'll see lots of boot camp groups and people out and about. But I think that's important in the cancer setting to, I guess, portray that exercise and physical activity, and this is a conversation I have with patients, it's quite a blunt conversation. I might say that what they might be able to do now is nothing like they were able to do before diagnosis for the moment. It's going to be really hard and challenging at the beginning, and that's okay. Because I think people might be intimidated that we're expecting them to do one of those boot camp classes that you see down at the beach. And that's not what we're going to do. We're going to do something really basic, particularly if they've lost a lot of strength and fitness. So it's sending that positive message that just something at the beginning is okay. There's a little quote that also we've used before. It's something is better than nothing and more is better than less. So getting patients on board is really important. Before, and having a goal of getting back to the boot camp class in Bondi Beach is definitely something that we can have, because that's what we do is in our consults as exercise physiologists. We do a lot of behavior change and goal setting. That's really important for people to think, why am I doing all this hard work and where do I want to get back to?
When you talk to patients about physical activity, one of the things that when I talk to them, one of the things that often comes out is how it makes them cope better. And I think in many ways, when I think about difficult day in clinic, when my patients are not well or where the clinic is overbooked or something goes wrong, physical activity is a way of coping emotionally. And I think that in many ways, there are some similarities here where patients and healthcare providers can learn from each other about using exercise as a way of managing your life a little bit better. So it's not exactly either or.
Yeah, no, it's definitely, I know that if I don't do exercise for just 2 or 3 days, I get cabin fever and it really affects me. And if I have a long day of meetings, and I can't even get out in a day, it really affects me. So just even having
Mm,
that 10-minute walk, like I think like there should be a culture shift as well to be doing walking meetings rather than just sitting all the time.
mm,
If you're in an office-based job, we're just sitting all day long. It's not healthy at all. So if we're able to do, break that up, there's this concept called exercise snacking, where it's like 2 or 3 minutes a time of movement. And that can be like going upstairs. And there's some researchers at Sydney University, Professor Manos Stamatakis, who specializes in this type of work. And just a few sessions of 2 minutes of vigorous exercise, like going upstairs throughout the day, can lower your cardiovascular and your mortality risk. So even if you're not hitting the guidelines for 30 minutes, just doing a little bit here and there is useful. Particularly breaking up the day. And if you don't have time to go out to do a proper session, just doing bits and bobs on the spot can be really quite helpful compared to doing nothing.
mm. You've been leading the way in showing, it's sort of leading by example, because you've been organizing the running group at the annual COSA scientific meeting. I hope there's going to be another running adventure in November at the Gold Coast.
Yeah, I hope so, because Gold Coast it's beautiful. My marathon PB is in Gold Coast. It's very flat. It's beautiful. It's nice beaches. So yeah, we've done a couple of years now at the COSA ASM where
Yes.
it's
Yes, we did Brisbane and then we did Melbourne, which I
right.
didn't attend. So I certainly am planning to turn up with my running shoes at the Gold Coast meeting. So hopefully there'll be a running group. I was particularly heartened to learn that one of the biggest cancer meetings, the American Association of Cancer Research meeting, which had a big fun run for charity, I think a 5-kilometer run. So I hope that one day that small meeting that you started is going to graduate into something even more substantial.
Yeah, hopefully. I think we maybe need to play it smarter. I also went to a conference in San Diego with the American College of Sports Medicine. That was, they had a big race sponsored by Gatorade. So maybe that's how they got it up and running. But there was 400-500 exercise people, as exercise physiologists and sports scientists. So very enthusiastic and fit bunch up at the crack of
Yes.
dawn. But it was so nice. It's very different. Like people are very different when you're networking in the professional
Mm.
space, in a conference setting. You got your extroverts who dominate in that setting. And it's such a nice way when we've done that run, when we did it together that first year in Brisbane, it was just a really good way to get to know each other, all different disciplines. We had people from medical oncology, we had nursing, we had biostatisticians, we had me from exercise, we had surgeons as well. It's truly multidisciplinary and it brought us all together. So it was a nice way to see the city and to network, and we can collaborate that way, come up with new ideas. So hopefully we can keep growing it. And for me particularly, it's a great culture thing because I can really continue to promote my cause, which is promoting exercise and cancer care to the people who are delivering those messages to patients. And because you guys are all seeing patients, so it's a great opportunity for me to network and go for a run.
Yes. So you've just given me an example of an area of supportive care where we can actually not just fix a problem, but positively affect the person with cancer and potentially positively affect the person who is doing the caring or healthcare provision for the person with cancer. So quite an unusual and quite a inspiring area of supportive care. So before we finish our conversation, I've got one question, David. Why, in your view, supportive care matters?
Such a good question. It's everything, isn't it? Like we've moved so far away from treatment is the only thing that we're focused on. Obviously, the treatment is saving their lives, but it comes at a cost. The cost of cure is high. And there's so many side effects that are caused by the life-saving treatment that patients are prescribed. And enter supportive care to find all those ways to help the patient solve the issues that have arisen because of the cancer and treatment. So supportive care can mean all this adjunct therapies and multidisciplinary teams and nursing and allied health professionals that were once considered a could have, but now it really should be considered a must have when we know that for exercise, at least, patients can live longer, healthier, and better lives from being more active. So I think it sort of moves from a patients could want it to patients really could need it. Supportive care is something that I'm grateful to see that it's become a standard part of cancer management. And I hope it continues that way, that we come with new, novel ways to support patients through, this horrible disease. And I think we will, because we're a really motivated bunch, us cancer researchers. We're always trying to find ways to improve patient care. And I think people like yourselves and all the other researchers in Australia will continue to strive to do that.
I think you've captured it very nicely. It's making people better. One walk, one run, one bicycle ride at the time.
Yeah, and one burpee eventually.
Yes, and one burpee. I don't know about burpees, David, but thank you. I'll take the burpees on notice.
That's okay. Thank you so much, Bogda, for having me. And to everyone out there who's seeing patients, continue to talk about the importance of exercise. It's really valued by them, and certainly one important way to help your patients.
Thanks, David. Awesome. Loved it.
Thank you so much.
That is all for Supportive Care Matters, a podcast created by me, Bogda Kozwara, for researchers, clinicians, policymakers, and patients passionate about improving the lives of people affected by cancer. Thanks to Mark Tai, who composed the original music, and the Oncology Network, our producers. For show notes, go to www.oncologynews.com.au. Subscribe to this podcast at your favorite podcast provider and rate us. It will help others find us.